the development of this clinical practice guideline was a process where a number of scientific societies have been working together to reach a consensus, not only based on the randomized controlled trials that had already strong evidence, but also a consensus to becoming involved in implementing this knowledge. So this clinical practice guideline was developed to explain to society, but also to colleagues, how they should, in practice, develop this knowledge with their patients. And so what it says, it has women in pregnancy need to have enough DHA intake. So this means that apart from their usual intake, that should be before pregnancy around 250 milligrams per day of DHA, this should be increased of 200 milligrams per day during pregnancy. This is not always achievable with diet, but it should be investigated at the beginning of pregnancy with simple questions, or potentially also with a blood test, but this is not still in the clinical guidelines. So therefore, if the woman does not have enough intake of fish, she should be supplemented. If we are not able to investigate adequately the intake of fish, we should supplement anyhow. So this additional supply should start before the 20th week of pregnancy and should be continued throughout the 37th week of gestation when we know we reach term of pregnancy, so then it can be stopped. So this should be really made available as a knowledge to all colleagues throughout the world to decrease this very important outcome of pregnancy, that is preterm birth.